morning, good afternoon, good evening, and good night, ladies and gentlemen, because I'm sure I'm addressing people from all over the world. My only connection with space health is really that I know Professor Thais Rusamono. I'm going to divide my talk into three parts. One will be our personal experience with providing healthcare in what I think is one of the most treacherous areas on the planet Earth, that is in the Himalayas at a height of 15,000 feet. This was how patients were taken on the top right hand side, you can see, before we started the first telemedicine unit. During the last 4 years, it has been our privilege to do more than 30,000 teleconsultations. We also run the world's only 24 by 7 tele-emergency services. And this really is where we deliver health care. I have been to this place twice, and the people whom you see in the center on the top are not laborers. They're all people with a master's degree in computer applications and a bachelor's degree in engineering. There are no equivalent of laborers there, and therefore I have a wonderful dedicated staff, and it was this staff who put up the first telemedicine center there. We have, for connectivity, we have a very small aperture terminal, VSAT, exclusively provided to us by the Government of India undertaking called BSNL. For security reasons, we are very close to China, hence private operators are not allowed to provide us with connectivity. As you can see here, this is the world's most treacherous road, and in fact, the first time my staff went to set it up, there was a landslide, and I was able to record the landslide from Madras when I was supervising them. So this is the place where for the last 4 years, we have been providing medical care. And I understand we're short of time, so I'm quickly go through the main message, which I want to give you, that nothing is impossible. Geography has become history. Distance has become meaningless. We have been able to publish several papers on this. Before telemedicine took place there, people had to be evacuated by helicopters. And you know, particularly in a developing country like India, how difficult it is to get bureaucratic sanction to get a helicopter. We are very happy that after we provided our telemedical services, the number of helicopter requirement has come down from 20 per year to less than 4 per year. Now, just a very few clinical examples. This is a ECG, a 12-lead ECG being transmitted in real time. Today, we are able to do a detailed cardiac evaluation when the external temperature is minus 30 degrees centigrade. And when there is a landslide, snowstorms, etc., my staff there are able to send this through VSAT, and I have a fantastic team of cardiologists, physicians, etc. in Madras. So far, we have treated 11 cases of myocardial infarction with antithrombolytic therapy, even as the myocardial infarction was developed. This is the standard of care which we are able to provide. The first ECG is normal, but my doctor says, look, I don't like the look of that guy. Don't send him back. Keep him there. Repeat the ECG after 45 minutes. The second ECG picks up an ST elevation, diagnosis of inferior valve ischemia, and my nurse there starts antithrombolytic therapy. This was a patient with supraventricular tachycardia, 240 pulse rate, and he would certainly have died. This happened on a Saturday evening, and the trained nurse was on leave that day. We had a young girl who had never seen a defibrillator in her life. But then my doctors in Madras said, don't you worry, we will handhold you. And we have a mannequin in Madras. Madras is a quaternary care center. We train candidates for emergency medicine. So my emergency doctor picked up a mannequin, demonstrated how a defibrillator should be used, literally handheld, telementored this young girl in the remote part of the Himalayas, told her how to apply so many joules, so much amperes, this, etc. And within a couple of hours, you can see this patient has come back to normal. Again, we also deal with public health. Our dermatologists picked up a scalp infection. He said it's a fungal infection. He insisted that we go to the monasteries at a height of 14,000 feet. We physically went to all the monasteries and picked up about 30 children who were all in these monasteries who did not even know that they were having a fungal infection. We also believe that promoting health education, patient empowerment, knowledge empowerment is very critical. And even in the Himalayas, we have been promoting health education to promote health seeking behavior. Again, we are very aggressive, we are very proactive with point of care diagnostics. My staff did a house to house visit in every single house in that particular district, and we noticed that almost 65% of women in that area had anemia and a significant number had diabetes, and they had absolutely no idea. This telemedicine department in the Himalayas gave an opportunity for innovation. I was so happy to listen to the previous speakers. You talk about innovation. The European Space Agency provides funding in a very, very, very small way. We in India have been able to develop a digital stethoscope. We have been able to develop a telespirometry entirely indigenous at 5% of the cost which we would have had to pay if we had imported it. COPD, chronic obstructive pulmonary disease, is very common at 14,000 feet height. And my pulmonologists in Chennai insist on a proper scientific evaluation. And today we are able to do what we call a telespirometry. And my staff in Madras are able to evaluate the pulmonary function capacity there. The next few minutes, I'm just going to tell you, of course, this is not my personal experience. It is only what I collected from the literature. The Indian Navy has embarked on a very major telemedicine program. Because I'm a civilian, I do not have access. I really do not know what is happening, excepting that 130 ships, 10 submarines, and 3 aircraft carriers, which are traveling all over the Indian Ocean and other parts, every one of them are going to have telemedicine units in the next couple of years, and through a dedicated military satellites, the healthcare will be provided to every one of them. India is indeed a paradox. On the one hand, many of you people may think that we are a developing country, the third world, and down south, etc. Again, we have one of the world's, it's even bigger than the Mecca congregation. We have once in 12 years what is called the Mahakumbha Mela festival, where 120 million people, more than maybe one third the size of the European Union, 120 million people over a period of 6 weeks come and congregate at this place. Obviously, a nightmare from a public health point of view. But over the last 10 years, we have been providing satellite-based telemedicine, and we have been able to diagnose cholera even when it has just started, and very major public health sections have taken place. There have been several expeditions to Mount Everest from India, and every one of these expeditions has had a telemedicine setup, particularly in the last couple of years. Of course, this is from the literature. As you can know, in extreme environments, this is nowhere, nothing related to space. But again, we must have some idea of what space technology will require and what astronauts will necessarily need to have. So you can see how telemedicine is used. This is, of course, in the armed forces. And I do not have access to what is going on, but I am told in most of the major wars today, telemedicine is a fundamental part of what is being provided. Earthquakes, and in India also during the tsunami, which we had a couple of years ago, telemedicine was introduced during the tsunami period. And psychological cases augmented by telemedicine in the polar bear encounter in the Arctic Research Station. India also has sent a team to the Arctic, and there are a couple of reports of how the Indian team contacted the medical doctors for healthcare there. In-flight emergency medical services. I actually started this about 10, 12 years ago. When I say started, I mean I tried my best to get it, but maybe we were too far ahead of the time. Today, I'm talking of pre-corona, Most of the flights do have email connectivity. You can make a phone call from 30,000 feet above the ground. And today it is absolutely feasible to take an ECG on board a flight 40,000 feet above the air and send it immediately. Now, boat clinic, we again have the world's largest, what is called Riverine Island in the Brahmaputra. I don't know how many of you have heard of the Brahmaputra, one of the largest rivers in India. And you can see, I went there. We wanted to start a telemedicine center, and this is a remote, isolated place. You can see how my car, the car in which I was traveling, gets onto a ferry, and the ferry goes about 30 miles. So today we have set up boat clinics again with VSAT connectivity. People in these most remote areas come to the boat. These boat goes from island to island, and from the boat they are able to connect to specialists and super specialists. The last part of my talk, I wish I could get involved in this, but it's unlikely again because I'm a civilian. The Indian Space Research Organization was scheduled to send India's first manned mission, 3 astronauts on low Earth orbit, 420 kilometers above the Earth. Unfortunately, due to the corona, it has got delayed maybe by a year or so. And just look at the photograph on the right. This is what India started their space mission, 23rd November 1963. India's first rocket was transported in a bicycle at the back of the bicycle. Today, NASA, the European Space Agency, have all acknowledged that ISRO is one of the 4 leading space agencies in the world. The Mangalyaan mission to Mars and several other missions here. And I must once again acknowledge my gratitude to Professor Thais for rekindling the dormant interest I always had in space medicine. Indian astronauts are now completing their training in Moscow, and we hope that even though it was delayed, we hope that by January 22, India's first astronauts would be in outer space. So some of us were interested in this, and India plans to send 2 humanoids before the actual astronauts go into outer space. These humanoids are they simulate a human being, including physiological responses in outer space, a crew escape system, etc. So all this is going to happen in the next 1 year. This is the humanoid which you're able to see. So to conclude, my knowledge is purely theoretical regarding this, and I hope through conferences like this, we will get the opportunity to interact with people like you who are doing absolutely fantastic work. But I just want to leave a take-home message that India is also in the running. Challenges are what makes life interesting. Overcoming them is what makes life meaningful. And I am sure that in my lifetime, I am a Sattagunarian, but I am sure in my lifetime, I will see the first Indian on the moon. Thank you very much for giving me this opportunity.